Hope you all had a lovely break. Good to see lots of good chats going on and everyone getting signed up for the clinics later on. So one thing we thought it would be really important to do was get a story from an innovator who has engaged with the NHS and who is actually kind of selling their services into healthcare. Of course, with Forward, we have a whole mixture of different companies, right from incredibly early stage to those that are a little bit more established. And so we felt the ideal person from Forward Company to come and talk to you about engaging with the NHS was Krishna Thakur from Capri Healthcare. So Krishna, do you want to come up and join me?
Thank you, everyone. Not blocking you.
You're right. No, it's all good. We're designed perfectly.
Yeah.
So, Krishna, first of all, can you tell us a little bit more about what Capri Healthcare is and what the journey has been so far?
Okay. So, for all innovators, first of all, thank you very much for inviting me here. We all should be good at storytelling, okay? So that's very important. When we innovate, we need to tell story. So it all started from my own family members who are, my wife is a doctor, my son is a doctor, and then surrounded by doctors, and we keep hearing problem every day. Yeah, and that is what I think triggered that, okay, let's do something which I have learned in my professional life, which is a digital transformation. Can we bring some of the ideas from outside world, outside NHS world, and then try and solve NHS problem? Yes, each problem is unique, but at the same time, you can transfer few of the solution to NHS. So that was the trigger point to start innovating and start solving a little bit of a problem, and that is when we formed Capri Healthcare. Started with one simple problem of GP not being available to their patients, and that was the trigger of the journey. Yeah.
And so it's interesting that I think for you, maybe more than some of the other companies, is that you came with this notion of you're just seeing all of these challenges, but you're also thinking we know that we've got certain solutions we can use to start to tackle these various challenges, but you still chose to focus in, and we know that focus is of course really important to get that early traction. Why was it that you chose to look at that challenge with regard to GPs?
So one thing was, obviously we were looking at the accessibility to your doctors, and invariably you must have seen when you call your GP practice and then say they don't have an appointment, or early in the morning 8 o'clock you sit in front of listening to music.
We've all done that.
Number 34, number 33, and then it takes forever, and then by the time they give you appointment a week later, you're already fine. And that was the kind of a challenges we were seeing. But at the same time, you might solve a huge problem, or you might solve a very small problem, but you need to look at the options of actually trying out your solution as well. And being just simply lucky that I'm surrounded by loads of clinicians within family and friend, we knew that there's a test bed available to me to go and try that thing. So if I come up with some solution, I can try there. And that is where one of the GP practice were willing to go and experiment with me and say, okay, you do go and produce something, and we'll try it out. And I think that is where I picked up this problem, that connectivity with my clinician is not great. How do I support self-care or divert most of the patient in right direction? It could be MSK issue, it could be FCP solving that problem, not GP, and not everything needs to go to GP. So I was looking from two angles. One was from patient perspective, that how do I make doctor accessible, but at the same time I was solving my doctor friends problem as well, that okay, oh my god, too many questions, too many calls comes, and then I can't handle everything. So I need someone to go and do this triaging for me, and then narrow it down that these are the 5 patients you need to see today, kind of. So I think I had problem from both angles, which probably again helped me in focusing on that, because I was solving the problem for multiple people by just one solution.
And so it kind of started with that place of curiosity, asking lots of questions, and we will talk a little bit more about kind of how we access those people if they're not in our family in a little bit later. But then I think you also, by doing that talking, by being curious, you're able to then go in and focus on that particular problem, and as Alex was talking about earlier, that kind of falling in love with the problem. Before I do delve into some more of those details, you'll notice there's a nice timeline here behind us. Can you talk us a little bit more through the journey so we've got that context of how you've moved?
Yeah. Sorry, it's too tiny, yeah. But I had to fit, 5 years and loads of things happening. So obviously, I was running a slightly more digital transformation organization prior to that, and it was more of a service organization. And so I started playing with this concept, but then I realized part of my other business of consulting business, you alone cannot do everything. So you need someone with you. So all innovators, so this is another piece of advice I would like to give it to you, that you find a partner, like-minded partner who's dedicated and who can complement you. Okay, they should not have exactly same skill set. They should bring something else so that you can balance. You can do some give them something and you carry on with something else. So I think that is what happened. I just bumped into someone like-minded person, and we clicked. So we founded Capri Healthcare in April 2019. Yeah, that's where 19. And while this was happening, I was already building this product. It was a self-investment. We were building this product with developers. And first time we went in October 2019, went live with one GP practice. Suddenly the PCN within other GP practices within PCN liked it, so they procured it. Then suddenly the set of PCN within the same area procured it. So it was a huge support for me. So you starting, and then within 6 months you are paying your bills. Yeah, so that was a great support. So it could be just pure luck, or I don't know, you being in right place at right time kind of situation. So suddenly 19 practices adopted our product, and it was a very simple product, not rocket science there. We called it DG Practice. It was a digital front face for the GP practices. Earlier they had a very clumsy, busy website and nobody bothered. They just picked up the phone. What we did was we streamlined everything and then made it very simple website saying, okay, yeah, if you need this, click this, just logical tree structure of that thing, and then that helped patients to go through that and then just contact right people. It was a simple, very simple solution. So you don't need a very complex solution. That happened, and slowly we started picking up, and then COVID came and Babylon came. Yeah, so Babylon started threatening GP practices, and all our 19 GP practices actually started feeling the pain of that. Somebody will come, they'll take, because loads of people, they started deregistering from their GP practices and moving towards Babylon. So the key thing what they saw was, they are providing a remote access to GPs. So that was the, I think, problem statement for us, was that people who work or travel, or students who leave their city and then move somewhere else, they need access to their GP, and that is what Babylon was actually offering them. So quite a GP practice actually helped us to build vConsult, which is a virtual consult. That was our first proper product, which was doing not website. It was a proper application which helped us. And that is where PPG got involved, patient participation group, GPs got involved. So we knew from the GP practice admin side, from doctors and from patients. So that became very helpful for us to actually talk to real people and building a real system. So vConsult became popular. We went into a OCVC framework, and they came up with loads of requirements. So we kept on adding loads of things. Few things are being used frequently, and 80% of functionality not being used, which was asked by OCVC. So this will happen in your life as well. You'll build loads of features, probably nobody will use those features. We did that. Moved into G Cloud 12. So that is important for everyone. So I think you need to have, if you're getting a bigger contract, people will expect you to be in some kind of a G Cloud or CCS. So please spend some time. And right now, I think 13 or 14 is closed down. But next time, whenever it comes, if you're not there, please go get into that. It's not massive. It's not difficult. It does take few weeks to fill everything, but please do it. That way, the procurement becomes easy. So that's one important bit. then same thing, we there was a framework for EERS, which is electronic eye referral framework. So we again applied for that thing, got into one of the first 6 or 7 companies. We were in that organization. Then there was a large whole nationwide procurement process happened. Unfortunately, we didn't win a single site, and that's where these people will come handy. I'll talk about that when how to get in. Genuinely, we didn't take their help that time. We should take their help right from the beginning. So yeah, G Cloud, moving to G Cloud, and then doing this. While we were doing that, again we somehow got introduced to one of the secondary care, highly tertiary. So you were saying that you must have spoken to primary care, secondary care. We got introduced to tertiary, super specialized Birmingham Children's Hospital, very specialized. And we started talking to one of the clinician, very enthusiastic clinician, plastic surgery, called Dr. Andrea Yester. Fantastic lady. And she's equally enthusiastic to solve the problem. And then we started working with her to solve 2 problems. One was a DNA, people not arriving for procedure. All the operation theatre is booked, but people don't arrive. And Birmingham is a very mixed population of various languages. Yeah, 17 or 18 different languages being used there. And the communication was going out purely in English, and probably half the people understood Urdu or Punjabi or some kind of language which they didn't understand. Oh, tomorrow I need to go. Very basic problem. And second problem was loads of junior doctors were leaving that plastic surgery department. They were so stressed out because loads of phone calls were coming. They were not getting time for clinical work. They were trying to firefight all the time. So they decided, they complained to deanery saying that we don't want to work for this department. So that was, so 2 problem area we started working. So again, this is the trick, work on real problem. As an innovator, I love creating some product, random product, and see like, oh my god, I'm falling in love with my product. But do work on real problem. So we started working on real problem with Birmingham Children's Hospital, and then that is where the TriVoice, this was launched in 2021. It took us loads of AI, very lightweight AI algorithm. Still follows some kind of a tree structure, very limited, because we wanted to follow NICE guideline and the local guidelines. So we didn't go for a full-fledged AI where it's generating some kind of ideas. No, we didn't want to do that. We wanted to narrow it down to very limited area. So we started working with the clinicians, and around 4 or 5 rounds of UAT happened. They came up with a different scenario of patient presenting complaint and all those things, and they saw whether the outcome is correct or not for algorithm before they could approve. Went through MHRA and everything. We did part of that. It was all learning. We didn't know about all this, so we were learning as we were going along how to get the security guys take the solution, how to get MHRA to take that, how to go on medical legal and all those things. It was all huge learning. But anyway, we managed to launch that. And slowly, within I think 6 months, 19 NHS hospitals around Midlands have adopted that. So all the pediatric ophthalmology, rheumatology cases going through TriVoice. Nearly 1,400 clinicians have registered, and they use this mobile app to refer children to Birmingham Children. It's a huge success for us. We felt, yes, TFO CVC framework, that is where we registered. And then we started feeling with quite a few actually tenders was asking for ISO 27007. So I think that again, it was a need. We needed to go and prove ourselves that yeah, we are secure, safe, and all the things. And these are all big box exercises, guys. You have to do it. Yeah, expensive, time consuming, but go through that. We went through that and got ISO as well. Then suddenly, lull period, yeah. It was like, okay, what are we doing now? We got some investment, then we attracted investment. Yes, at that point we have not put that here, but we managed to get some investment after approaching multiple people. The first round of investment came, and that gave us slightly a bit of a energy to hire a few sales and marketing people.
Can I ask, what were the investors marketing, or what were you investing in at that point? What were you pitching to them?
pitching was Travis.
Yeah.
We were pitching the Travis, but I think if you anyone have spoken to investor, they invest in you, not in product. They just care about you, how passionate you are, and are you doing the right thing or not. So they might be just choose the market or area of the investment, but they just look at founders and how passionate you are and you're doing, and they just invest in you. So that is what happened there, and they agreed to do a second round of investment as well. So that has happened. So we are now looking for third round of investment. But while we were doing that, it went quiet, and we managed to impress one of the NHS digital clinician who was actually reviewing our product. He decided to join as a medical director to in our company. So he joined. He left NHS Digital, came and joined us. Sometimes that helps. Again, that's another piece of information that helps because they know some other people and they know what NHS want to hear. Yeah. So you need to speak this exact same language. When the people who approve your or they say, okay, we'll buy this product, they need to hear certain music, certain frequency, and you need to speak in that same language. Fantastic product, but you need to speak that language. So we hired him, and then he managed to actually introduce us to North Central London, ICB, and we actually kind of slightly moved away from Trivise, but it was more, we wanted to go and do the business analytics and all those things within Trivise because we were collecting loads of patient data, loads of conditions and all those things. So we wanted to use that data to get the insight. So we managed to actually, you were talking about Core 20 and 5+5, and that was the initiative which we then caught our attention, and then we said, okay, let's start dealing with the population health. We were initially narrowed down to a very pediatric world, but then long-term condition kicked. So early this year, we managed to launch our product with 180 or 160 odd GP practices. They're using our PI dashboard to see how they're performing on long-term condition and which particular area is a hot red area where maybe a hypertension is prevalent, or this area is diabetes prevalent, poverty is here and people not traveling to hospital and those kind of things. It gives loads of insight. Brilliant product. Again, too early to say whether the other ICBs will go in and adopt that or not because it's a new thing. So that's happening. And then around same time, they like the product for eye emergency. So there's another big eye emergency hospital. They decided to buy our product, which is Birmingham Midland Eye Center. They decided, oh, okay, we can triage our product because there's a huge queue and people literally queue in front of the hospital up to the main road. So that's genuinely that's situation there. People queue because people just walk in there. Anyone you go to Optom or any GP and they say, yeah, go to BMEC, and they just walk without any pre-triaging or anything. So there's a long queue. So we managed to win a contract with them. So again, we wanted 3-year contract, but they wanted 1-year contract to trial it out, and that usual stuff. And then finally, we managed to recently go into NHS app. So integration, you were talking about integration. So we managed to integrate with NHS app as well. So now the app is available through NHS. So more GPs are comfortable with that. So that's a kind of a journey of last 5 years. Just wanted to give you like context point of view. Probably now next question or the discussion we'll talk about how did we knock those doors and open those doors.
Exactly, because I think there's a few things that jump out to me in your journey. One is this closeness with the market is so important. Like these conversations that you're having all the time, initially with those friends and family, but then like with all those different stakeholders, and that's what's allowed you to come up with or really understanding these problems. You mentioned a few of these cases where your solutions are relatively simple actually, and that's where the success is. And what I like about this journey as well is you have managed to tackle different problems here. You haven't just been pigeonholed into one. Now, in the beginning, if you were up here and you were saying to us, we're gonna have this eye solution and we're gonna have this the solution for GP practices here, and then we're going to do the bigger consult on the NHS app. Everyone would be like, no, this is like too unfocused, you're not going to be able to solve that single problem. But the truth is, by focusing, you've been able to actually then tackle various things along the way and along this timeline. But yeah, let's go back to kind of what I'm intrigued with is when Alex asked the question earlier about what was selling to the NHS, your response was, but let's be honest, you've been relatively successful at selling into the NHS, and I'm sure a lot of people in the room would be like, what? You could pay your bills within 6 months?
Yeah.
So do you want to talk to us a little bit more about some of those challenges that you faced and how you've overcome them?
So clinicians are clinicians, yeah, first of all. They're not business people, right? They know how to treat patients. That's their forte, yeah. So don't expect them to be suddenly very business-minded people or going and trying to convince for because one of the clinician will be like, wow, so finding champion, you were saying that, find your champion. So we found few champions, and then constantly we're looking into that. So when we go on our sales team going and talking to various hospitals, we actually look for LinkedIn as a good spot to identify who are like digitally clever clinicians, who are like genuinely love doing that kind of innovation. Talk to those people and build that network. And that is where what happens is they try and influence people. A normal clinician cannot influence for example, one clinician, typical, they just love reading the letter coming from GP and then triaging from there and then say treating patient, and they still love it. And they cannot go digital, they cannot trust actually AI deciding that this is a high priority or low priority. They just don't trust that at all. Whereas even after me giving evidence that, yeah, hang on a sec, we have spent 2 years sitting with clinicians, actual real clinician, your own colleague, to come up with the algorithm. No, they don't trust. They want to still read that thing. They still want to receive the phone call and triage that. So that will happen. Clinician will be clinician, but you find the influencers. Find generally CTO, CIO who has just taken over. They're very keen to prove themselves. That's another trick. Genuinely, if they are well settled, they're just looking for a different job. Trust me, in 3 years' time, they'll be leaving that place, and that's a reality. Correct me if I'm wrong. Yeah. So look for those kind of people. So it's a very I don't know how many people have done project management, stakeholder mapping. We used to do that in part of a project management. So you do the mapping, identify those people, socialize somehow, manage to get into their club, and then probably that is a one way of entering the market. Another trick what we did was we kept our license price below tender level initial to enter. Yeah, sorry. That's
it's okay, I don't think she's gonna say.
So we kept the price. Our product is SaaS product, so I think most of you will be doing the SaaS kind of product nowadays. That is the area. We kept our price below that so that we don't attract loads of this one. And then if the clinician and CTO liked it, they said, okay, I will buy it for 1 or 2 years kind of thing and try. And make your product sticky so that they can't get rid of that. So integration became very important for us, because one moment you integrate, it becomes sticky. Then they can't get rid of your system. That's another trick if you want to stay there. And that's how we entered the finding right people to get introduced and all those things. So AHS and your predecessors, and they did help us some time to go and introduce us to a few people, saying, okay, they got some brilliant idea, do you want to have a look? And that's how we got it.
So in order to get that word of mouth, you really need to build trust with people. What do you think that you do to really get that trust, especially in the early days?
Early days.
Yeah.
I think clinicians trust clinicians. They won't trust techie people. They won't trust your salespeople. So only way of word of mouth is if a clinician is talking to another clinician in one of the conference where they meet annually for their CPD, and they're talking, oh, we use this product and that works. That works. And they are impressed. One clinician is impressed, like you were saying that, yeah, there's one guy who like start talking and singing about your product. It does help actually. So find those champions who can talk about you. Um, Andrea was very clear. She right from wherever she goes and speak about that us, and she clearly says, "I do not have any shares with these guys. No conflict of interest. I'm just using their product, and that's why I'm just telling because it's a brilliant product." So I think find few of them. Find few of them to talk about your product.
Can you talk a little bit more of the transition, and maybe you're still doing this with some aspects of your or some of the products, with the transition from those kind of early adopters and people who might be excited about the change to those who are maybe at least the early majority. I'm sure like there's plenty of laggards who probably aren't going to engage at this point, but that shift and how whether that's been straightforward to kind of go from those like excited people who are going to innovate because they like to innovate versus those who are going, yes, this is really solving a problem for us.
Yeah, so even if you're solving problem, the people on that side, they'll just put blockers. They will just point blank because they just love the old way of doing it, don't change it. So they will be there. So it's a difficult journey. Anyone done change management priorly in your previous job or something? It's a very 80% population, they don't want change, knowing that change is the only constant, but they don't change and they won't change. So these people are really, so we're working with NHS Wales right now, and so we were lucky that NHS 111, they contacted us from there and they said, okay, can we build a symptom checker? You already have a symptom checker AI based, can we implement on all those things? So I think a few of them are there, are genuine people who are influencers. They'll socialize your idea, they'll go around, talk to various people, they'll find their friends, build their own network. So you need someone, actually your salesperson sitting in your NHS as well, because they should believe in your product because you have solved their problem. So again, going back to, don't say, yeah, this is my solution, buy it, won't work. If you're solving their problem, probably they'll sing. Yeah, they will seek your praises because you're solving their problem. So I think that is what something happening, and they going around, and we know that there are difficulties. And LinkedIn was another source where one of the clinician, actually geriatrician from Swansea, contacted us and say, can you build some ward related communication, because they're paying loads of money because people are complaining and we need to settle those cases because the grandparent was they were admitted, they did not get their correct updates and all those kind of things. And we built a product called Patient Central with him. And we just found a random clinician coming and talking to us through LinkedIn. But again, we need those champions to convince internal. It's not easy. Going back to business case, writing business case, you as a innovator or founder, you won't be good at writing business cases. I can guarantee that. Only few of them you can actually write a proper NHS style 20-page business case. It just ask for help, which we realized after 5 years. Honestly speaking, we thought we can write. We thought ChatGPT can do the job. No, it doesn't do. It will do up to a certain extent, but take health innovation help, because they are good at doing that thing. Health economics, we never thought about that thing when we're writing our business cases. Then realize, oh my god, that is a huge thing. Net zero, okay, we'll just put some paragraph. No, it doesn't. It makes a hell lot of a difference, actually, people who read that. So they need to read all those things, so please do take their help to write business cases.
And something that's been mentioned already today is having evidence. How much of you has evidence played a part in being able to kind of give other people what they need to advocate for you?
Okay, so we did the same mistake. We were so excited about the project to start working on that project. We did not baseline any other KPIs or any factors which we were trying to improve. That was a huge mistake we did when we started with TryWise. Because we were too excited. As an innovator, you're excited about the project. Oh my god, project and paid project. Even better. I was like, oh, let's do that. Let's do that. And we did that. We did not record all those things that prior to TriWise, this was the situation, how many hours we were taking and what was the time wasting and where was the bottleneck and what we were solving and all those things. And then the post implementation, then you realize, oh, I need to prove. And then you start putting things, then you say, oh, where's the pre-TriWise? Then you cook up those data. And then again, health innovation start challenging those data. Rightly so. And I initially I was so annoyed, Alex. Honestly speaking, when I just wrote this, not you, it wasn't you. No, and I'm saying that's what I'm saying. I'm thanking now because I was so annoyed that, oh my God, I wrote this much of paper and I collected data and all those things for the last 5-6 years. Did all the various what I studied back in 2000. When did I do my MBA? Long time ago, 10-15 years ago. I used all the statistical analysis method and all those things, and then now they came back with 20 odd objections and observations and all those things. And then I realized actually no, we needed those data to prove our point that this has happened. And then doctors actually their brain works in that. If you simply write, yes. Yes.
What objections were there?
First of all, so let's say you've written some hypothesis right at the beginning. Okay, this is my assumption, and you're trying to prove. You're not a professional researcher. I'm not a professional researcher. Yes, I have written some papers initially, but not professional. So I've started, because again, we are in so much of love with our product. We talk about products. We just come back to salesy kind of thing rather than sticking to, okay, here's my question, and this is what the question I'm trying to answer. This is the related data and this. So objections were like that. Okay, is it the right question you're asking? Is the right kind of a data? Is that the right analysis? And if you're saying that 80% of triaging accuracy using AI, so our system is giving 84% of triaging accuracy. Is it good enough? Where's the evidence? Is there evidence saying that 85% of accuracy in triaging is very good, which I'm saying is very good, but who else is saying that? So then I realized, I need to go and find other papers. Then in order to find other papers, you need to have access to all the research databases, which probably you won't have funding for that thing. I didn't keep any funding for going and subscribing to those. So important thing was that, so we managed to get some data and then started proving that they were saying if, between 80 to 90 if there's a good accuracy of triaging, AI based triaging. So I think those kind of things which will happen here. So KPIs, do baseline before implementation and after that, and then regularly do it, not just 1 year, first year, and then you've done publish every year or every quarterly or whatever frequency you would decide, but just measure all those things, whether it's still happening or not.
I will come to the room as well if people have questions in a minute. I think one of the reasons founders don't always kind of really go there with that, like going deeper and deeper and deeper, is it can actually be quite scary, because if you collect that evidence, there's a chance that it might disprove that your product is going to work. Is that something?
That is a fear. Because we don't want somebody to come and shatter my dreams or my what I think, and I always you can relate. Everyone can relate. We just love our product, and it's like a clever idea is going to fix everything, and then somebody comes and tells you the truth, and it's like, no, it's rubbish. He's wrong or she's wrong. Don't listen to him. But you need to put that filter as well, because sometimes some people are totally negative, so you should be able to identify who's actually genuinely giving the feedback. So I think that's a fear.
Is why having like proper structures in place to do some of that evidence gathering is good, because then you can be more objective about it. And also it's not just about, that was one person's opinion, or that you can actually kind of decide what those tests are, and you can uncover the assumptions that you're making.
Absolutely.
So in terms of the journey as a founder, how is that from a kind of personal perspective? Have you had to make sacrifice? Have you had big challenges that you've had to go through?
Loads. Luckily, my partner, my wife is working, so it's a good support, financial support there. You need to keep the wheel running and keep the
Yeah.
machine running. So that sometimes it happens like initially when you launch, and we were lucky that we managed to find some customers, but you constantly innovate, and especially if you're any one of you working in AI, it's a very yeah, resource consuming activity. Engineers are expensive, servers are expensive, data is expensive. Uh, it takes loads of money and investment, and sometimes you find that yeah, you're not paying yourself because you need to pay your staff members, and for few months, not just 1 month, few months is like, oh, I'm sacrificing my salary, I won't take. So for I think when we started their journey, I think 6 months we didn't take any salary. Um, and then COVID hit, we started working from home, so the rent we started paying to ourselves, so that okay, oh my god, we need some money to contribute to our family. So whatever money we were paying for rent, we started, actually me and my partner, we started sharing that as a like, okay, 500 each.
Mhm.
So I think that challenge will
Yeah.
happen and sometimes especially if you're in product market, uh, yeah, it's not constant money. Even if you're on SaaS market, it's not constantly flowing. So this it's not recurring. Yeah, it
Yeah.
does happen.
Have you had those moments where you've like put something out there and then it's gone like horribly wrong in
Yes.
some way, and then yeah, you have to pick
So
up
you
the
come with
pieces?
the 10 thing and 9 things go horribly wrong. One thing clicks.
Yeah.
So don't shy away from experimenting and trying. That's why you must have seen loads of product being. Again, I wouldn't advise that you divert your brain in 10 different products. You focus on one product. But what we slowly started realizing that we are building a platform or a capability kind of thing, and that same capability could have been used somewhere else. So virtual consultation was a more patient to clinician conversation, or video and all those things. I'm using a few of the triaging mechanism there. We used for consenting process as well. So perioperative or preoperative processes happens in same thing, and Trivas was triaging, and same triaging patient was getting operated by plastic surgeon. So we thought, okay, why can't we just add consenting process to that? So we just enhanced our product, same C2C, person to person, one to one communication device, but we used it in somewhere else. So we were lifting and shifting our capabilities of the software into various scenarios, business cases. So that's why the product might be coming, but we created a very modular product, so that if somebody wants just purely consenting product, then yeah, have it. You can have it. You don't need to have a big, huge, large TriWise. If you want just purely triaging, you can have it. We consult, you can have it, and those. So we came up with that kind of architecture. So make it more modular.
Yeah, and then you can be more flexible
Yeah,
to
more
the
flexible,
needs
yeah.
of the community. Okay, so we've only got a couple of minutes left.
Okay.
I know it goes very quickly. Have we got any questions in the room?
Cool.
Yeah.
I wanted to ask about moving from having a design or showcasing partner into a paying customer, because I mean, you talk to people, they're really keen, and then you find some stakeholders in the entity who expect a perpetual license. So is this common? What do you think about that? How do you talk money with people who already champion
Talk money.
your product?
Talk money. You unless you ask, nobody will give you. They're happy to do a free trials of everything. Yeah. So one thing I think statistically proven that free trial, although we offer free trials of your pilot, it doesn't translate into money. So you got to ask money. If your product has got something really useful, people will pay for that thing. So ask for money, because that is what will help you to sustain. If there's no money, you'll, even if it's a brilliant product, you'll die. That's a simple formula.
On the back of that, I would also say, sometimes it's very tempting to give it free because you think, oh, that'll make it easy. But actually, if they are willing to put, even if it's just covering your costs up forward, they're more likely to invest in that project. You know, they a bit of skin in the game. And I think, you know, I was a great one for giving things free, and then I suddenly just thought, actually, I'm not getting any sales. I'm just giving things free. It's,
Yeah.
you know, this is not a
It just-
charity. And ultimately, you just have to be bold and just go, you know, this is a business, I have to make money, I have to pay my mortgage and feed my family. You know, if you want my product and you think it's good, then let's work out how to pay for it.
Yeah. Look for grants, lots of grants also, if you want to sustain till somebody starts paying. But do ask, simple.
But initially, it may be a good idea to offer a discount and get a couple of organizations on board, and they can also act as to provide feedback to others, references, as well as trialing your product, helping you improve it. So when you're starting off and building that product, that's quite helpful. But then, as you say, later on, you need to get people to pay for it.
Yeah, because we did that. We gave products free away, saying part of it was we want feedback. And all they came back, can we have some more product? Oh, yeah.
I mean, that's some feedback.
Feedback is,
I want more, that's not bad. Yeah. So, I do have one final question before we. Yep.
What do you think are the benefits of being on G-Cloud?
G-Cloud, one thing is the procurement people, they'll ask 20 questions. The moment they say, you're on G-Cloud, they'll say, okay, fine. Because it becomes easy for them. It's easy for them to go and procure it from there. Because then
does all the due diligence for
yeah,
it.
they already do that. Yeah, so they'll find out about your insurance, indemnity, blah blah, and everything, whether you're legally registered or not. So you've gone through the checks, tick box exercise of G-Cloud. So for procurement, it gives them assurance that it's a genuine company, we can buy from there, and easy to do call of contract from there. So it's worth going through that. Anyone?
My final question is: you mentioned that investors invest in the person. What do you think they invested in with you?
Ooh. I don't know whether I came across like that in here or not. But they saw passion. And then I think we all are, if you're sitting here in this room, you're passionate about something, passionate about solving the problem. And again, focus on solving the problem. Moment you start focusing on that, I'll create a company and sell it in 3 years' time for 5 million and I'll just retire happily. With that intention, I don't know how many people are successful with that intention, but if you genuinely think about the problem, genuinely want to solve that thing, it will come across. They will talk to you and they'll feel. It's similar like job interview. You can't fake it. Mm-hmm. They will catch you, and that's what happens with the investors as well. But when you speak to them, they know that you genuinely trying to do something, and then there's a scope in the market, and you're solving right problem. Because again, like you were saying that you must have built the product without even trying to find out what is the problem. So we are trying to expand into a different country now, because I think we've seen the problem. I should have spoken about that. Yeah. So NHS is slow. Very, very slow sales cycle, 6 months to 1 year kind of a thing. And even now GPs become so difficult, because GPs used to be very, very easy to buy. So GP would quickly buy because it used to be at their own. Now after, they started merging with multiple GP practices, they have like tight control over money and PCN deciding things, ICB deciding things. So so that would be one of my advice. Go explore other market as well. Wow. So we started doing Middle East. We've launched our product in India, very specific to pediatric treatment, where the child are getting a long treatment like a year, speech therapy or physiotherapy kind of thing, and any developmental issue with the kid. So very specific to that market. That market there's no EPR, so we managed to break into six hospitals there. So explore other market as well.
Which
don't limit.
After the break, we will be talking about.
Yes.
So that's a perfect segue. So we'll take another break now. I think about 10 minutes again. Stretch your legs, and then we'll be joined by a panel of people exploring alternative pathways. So thank you so much.